I hope you're doing well today. I'm Dr. Nirvana, and I'm under the impression that you'll be receiving a full cranial nerve exam today. Is that correct? Okay, great. Just a few questions before we start, just to validate some information. Can you just give me your full name real quick so I can find it here? Okay, there we go. Let's see. And today you're seeing full cranial nerve exam. Special case with your eyes completely closed throughout the duration of this exam. Does that sound right? Okay, good. These are always my favorite to do. Alright, now what is your date of birth? Okay. And are you still at this same address that I have on file here? Okay, yeah. Information must just be carried over from system to system. Okay, and when was your last appointment or exam or checkup or anything like that? Okay. And, let's see, your shoe size? No, I'm kidding, that's not a question here. Last but not least, have you been experiencing any sensitivity issues, any visual issues, auditory, anything like that? No, well, that's good to hear. So, looks like this will just be a standard checkup type appointment to make sure that all of your senses are working correctly. Okay. So, what I'm going to do today is go through each of your senses, from vision, hearing, taste, smell, touch, all the good stuff. And, yeah, like I said, for this individual case, you can have your eyes closed throughout the entire exam. In fact, it is imperative that you do, just to make sure that your vision doesn't impede on any other sense, okay? Just to make sure that everything's working correctly, alright? Okay, good. So, as you might expect, we're going to start with your vision, okay? So, like I said, go ahead and just close your eyes. Keep them closed. It's gonna be fine. Nothing you're gonna miss. Just relax, get comfortable, and get comfortable with those eyelids closed. All right? Okay, good. So I'd just like you to tell me when the light passes over your eyes, and well, you can see the light through your eyelids. Just indicate to me that you see some type of illumination behind them. Okay? Okay, good. Okay, nice and slowly here. Okay, good. Right, very good. Yep. Okay, great. Just gonna go a little bit over on this eye. On this eye here. Okay. Yep, there it is. A little bit over here. Okay. You see it pass through, right? Okay. Good. Okay, great. So just tell me which eye you see the light pass over now, okay? And which eye? Okay, good. Both eyes, yes, correct. And which eye? Okay, great. So that looks good. Now just to see that there's no impairment when something passes over that light, just like you to tell me when the light is obstructed from your point of view, and I'm going to count from 1 to 10, and at the number that you cannot see the light anymore, through your eyelids of course, I'd like you to tell me what number that is, okay? So say, just a practice run, I'm going to hold this object up that impedes the light, and I'm going to hold it and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? And so, what number did you not see the light? 5. Okay. Yes. So it's just going to be 3 runs of that, just to make sure that you can tell when light is coming through and not coming through at you. Okay? Okay, great. So again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, good, good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and what number? Yes, 9. A little bit over here. Again, last time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What number? 3. Correct. So that looks good. Just write down 3 for 3. You don't see that too often, do you? Okay. Now this is a little different from the vision, but it goes along with this sense, okay? It's a sense of what's in front of you, and for some people we call that intuition, okay? Now this is an intuition test, and I'm going to hold a stick, a rod, whatever you want to call it, in front of you, in front of each side of your point of view, and I'd just like you to tell me what side you feel the object is on, okay? And now we'll do a test run to make sure that you understand, but okay, so I'm just going to hold it up here, alright? I'm going to hold it up, and with your eyes closed, just tell me which side you think it is on. Okay, yes, correct. It is on your right side. And so I'm just going to do like that for 3 times, alright? Okay. Okay. Now, keep them closed. Just going to come in with the stick. And what side is it? Left. Yes. Okay. Now again. What side is it? Right. Alright. Now, last time, what side do you feel it on? Right. Okay. Very, very good. Actually, shockingly good. I do this with some of my patients, but I really test your intuition by a little deck of cards here that I have, and for my patients that are able to get the intuition test correct for every time that I try it with them, I show them a deck of cards, and I ask them what card I think that I'm holding in front of them. And so, with your eyes closed, keep them closed of course, just tell me what card out of this entire deck of cards am I holding in front of you? Well, that's a good guess. Unfortunately, it is the Ace of Spades. That one's a hard one. Okay, there's a lot of things to choose from, but let's see. Let me just finish writing these down. Okay. Now, moving on to hearing, I have a few objects here that I would like you to guess what they might be. Now I'll start off with something fairly easy to guess what it is, and I'll work my way gradually up. But I'd like you to guess the object and also what side it's coming from. Okay. So eyes closed. Eyes closed. What is that? scissors? And what side was that? Yes, yes, okay. Good, good. Yes, there you go. Yep, and how about here? Good, good. Okay, now how many snips do you hear? Okay, there you go. And how many snips do you hear? Okay. Yep. Looks good there. Okay. Now keep them closed. Next object. Okay, now what object is that? It might be a little harder, but I think you can still guess this one. Yes, it's a book. Correct. Now, what side? Good. And what side? Good, good, good. Yes, it's the Rolling Stones Interviews book. I got this as a gift a couple of years back. And honestly, I love it. It's mostly a decoration at this point for me, but I still like to look through and see some cool classic interviews. I'll flip to a random page. Clint Eastwood, Joni Mitchell, George Lucas, Neil Young. A lot of really cool people. Okay, now this might be a little harder, but listen closely. What might that sound like? Okay. Well, it's a can of Altoids. Very strong mints. Now, what side do you hear this on? Good. On what side? Okay, good. And what side? Okay, good. Very good. And I'll save one of those for later for your taste test. Okay, last item. Probably the hardest, but I have faith. I have faith. Okay. And just to get a better idea of what the texture sounds like. And in here there's some liquid in there. Any guesses? Well, it is cologne. based on the objects, you are very easily able to tell your left from your right. But let's see how you do in guessing the word that you hear. Now I'm going to come a little bit closer, if that's okay, and whisper slightly inaudible a couple words, and I'd just like to see if you are able to decipher what it is that I'm saying. Okay. Excuse me, I'll just come a little closer here and whisper into this side. Kaleidoscope. 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 Any guesses? Kaleidoscope, yes. Now, this side, I'll come in. Juxtaposition. 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 That one might be a little bit easier. Juxtaposition, yes. One of my favorite words. Such a fun little weird word. Okay, let's see. What should the last word be? Okay. I'll come in. Phosphorescence. 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 Yes, phosphorescence. Very nice word too. Okay, just write this down. Okay, now I'm just gonna be able to test a little bit here if you can decipher what's close versus far when you hear it, okay? Okay, so I'm just gonna take these mints and just tell me if it's close or far, okay? Yep. Okay, now some of the scissors. Yes, very good, very good. Okay, there you go. So it seems as though your hearing is just fine, which is always good. Okay, so now seems like a good time to go over to touch and texture. And what I have for you today in this regard is pretty simple, I would say. I mean, I have a couple of objects, and I'm just trying to see if you can distinguish whether it's soft or sharp or nice feeling or not nice feeling, okay? So, and if you can guess what it is that I'm touching you with, then that's bonus points, okay? Okay, so just eyes closed, relax your face. I'm just gonna get a little closer again, alright? So, is this sharp or soft? Okay, very soft, and that is indeed a cotton ball. Okay, I'm just going to come in with something. I'm just going to come in right here. Okay, and again. And okay, up here. And down here. And is that sharp or soft? Okay, last thing. Just going to come in here. Okay. What does that feel like exactly? Yes, it's a Q-tip or a cotton swab. Very good. Very good. Let's just write that down. And alright, so now on to smell. Now what I have for you today is some candles, and they're kind of recognizable scents, but if you need help, you can say a general or vague type scent, and I'll accept it if it's within reason. Okay, so eyes closed. Like I said, I'm just gonna hold this up to your nose and just take a nice big whiff. Okay. Yes. This is vanilla noir, and vanilla is acceptable, of course. Okay, let's see, another one here. And whiff. Okay. A little bit harder, yes, I would agree. This one is actually jasmine santal. I'm not so sure what the santal means in jasmine santal, but it's very delicious, if that's what you could call a scent. And last scent that I have here, you're not allergic to peanut butter or peanut products, are you? Okay, good. No reason. I'm just going to hold this up. Go ahead and take a deep whiff. Yes, that indeed is peanut butter. That's more for jokes. Usually if you get the first two right, I mean, there's no harm in messing with you a little bit. Okay. Last but not least, all we have left is taste. And what I have for you today is a choice between some of the Altoids or a glass of juice. And what I'm really just trying to see is if you're able to taste what I offer. And which is your choice? Okay. I'll pour you some juice. Is strawberry alright? Okay. And this is probably my favorite flavor of juice to end off every exam or shift with. And so, hopefully, you can enjoy it just as much. So, let's see. I could just take a nice little sip of this and let me know what you think. Okay, I'll just set that down. Yummy? Okay, good. Well, I hope you enjoyed that little roleplay video. And if you couldn't tell, I really enjoyed making it myself. I don't know, just getting into all that medical terminology and learning about these senses and the cranial nerves in school has just made this even more exciting and fun for me. So yeah, I have a lot of fun with these videos. But yes, I hope that this